This module will cover nutritional problems. An overview of this chapter includes 5 different sections: normal nutrition, vegetarian diets, malnutrition, specialized nutritional support, and eating disorders. Normal nutrition, this should just be a brief review. So quickly review this section, remembering the importance of carbohydrates, fats, proteins, vitamins, and minerals within a diet. The section on vegetarian diet, just review the different types of diets and what they're either lacking or what different supplements they need. And then think culturally competent care. How will you consider different cultures in your care? Not making assumptions that somebody that represents a culture is automatically going to have those dietary choices, but really exploring your patients to find the correct diet and nutritional needs for that culture. And then be thinking, how can I educate patients to meet the nutritional needs with different diets? On the section on malnutrition, know the 3 different causes of adult malnutrition and what factors and conditions they contribute to. And then there is a large section that covers the pathophysiology of starvation. Review this briefly, but don't get caught in the weeds. Just look at the overview of what is the process within the body that causes starvation. Then look at the clinical manifestations. There is a very wide variety, anything from very minimal symptoms to starvation and death. And then nursing management. How will you assess every single patient that you take care of for their nutritional needs and if they have different malnutrition aspects? And then how will you care for these patients and what will be your goals? Briefly review refeeding syndrome as this is something that can definitely occur. And a high note is that older adults are particularly vulnerable to malnutrition. There's talk in previous sections of how older adults, they lose their salivary glands, they don't have an appetite. So really look at, hey, this population of people, if I'm taking care of them, I really need to assess them for malnutrition. Specialized nutritional support. This is one of the most important sections in this chapter. So really look at this, especially anything you see with nurse management and nurse as what you're going to do to care for these different kinds of nutrition. So the 2 nutritions they really talk about is enteral and parental. Enteral nutrition, know your different delivery options and your tubes. Where do those tubes go? How do those tubes get put in? How long can you use those tubes? And then review the safety of the care of these tubes very closely. Preventing aspiration and infection is huge. Keeping the tube patent. How will you manage different problems? There's some really good tables in this section that you should really review of what you're going to do to care for these patients. And then when it comes to parental nutrition, know the difference between PPN and CPN, and realize that these are really high risk for infections, and what are you going to look for those infections. And just being very careful of lines and tubes, and we call it tracing your lines, making sure the right nutrition is going to the right tube. The final section is eating disorders. Know the difference between anorexia and bulimia, and what is the treatment. Don't spend a lot of time on this section, just quickly review it and think, if I had a patient with this, what would be my treatment?